Welcome to this week's show of The Authentic Physician, the show that's about ambition, identity, and health transitions high achieving women are rarely prepared for. If you're juggling leadership, career, caregiving, and a body that just suddenly is having its own agenda, even though you've done nothing different, you're not alone. Here we have honest conversations about medicine, midlife, meaning, transitions, and what does it take to lead without losing yourself. It's not about perfection, it's about alignment. And today I have a lovely guest with me that I think you're going to really enjoy hearing and learning from. I myself just recently met her through a mutual connection, and I'm excited that you're here. So, Dr. Cynthia, introduce yourself to us and tell us, take a couple minutes, tell us what you do in your life and why you do it.
Yeah, thank you so much for having me. Man, what do I do? That's always a good question because I
Mm-hmm.
think that has evolved along with changing identities over the last couple of years. So I'm a physician career and life coach, and now currently, if you're looking at job-wise, career-wise, what I do, I am a inpatient director part-time at a family medicine residency program. I'm a part-time medical director of a multi-specialty private practice, and I coach physicians and I do in-person and retreats around trauma-informed care for physicians and professionals. And so, yeah, I do so much advocacy work, and I see all of this as advocacy work too, but particularly around my specialty, because that's important to me. So when you talk about alignment and
Mm-hmm.
we don't have to show up as perfect about ourselves, so much of that resonates, because
Yes.
that was a really long journey that I went on that kind of brought me to where I am today, which is a much better place than where I was a couple years ago.
Oh, I love that. And I'm going to ask you a different, totally 180 different question in just one second. But before I do that, so that our audience is aware, I think I know what you mean by trauma informed care, but that may not be the same as the word trauma and the emergency room or trauma bay, or it may be. So tell us what you mean when you say trauma informed care.
Yeah, I think so much of it is just meeting people where they're at. We talk a lot about it in medicine for our patients, but
Mhm.
my focus largely is around physicians. And so, and I like that you mentioned, when we talk about trauma, we often think about it as a single event, but
Mhm.
we know now that it's less about the actual event itself and more about what happens to us in our nervous system as a response to the event. So
Yes.
the same thing happening could be experienced very differently by two different people, and then the responses
Yes.
are very differently. And so a
Yes.
lot of that lives in our nervous system. So for high achieving professionals,
Mhm.
any professional really, but for physicians, because that's a lot of my work is around that. The nervous system is designed to protect us. So when we are undergoing chronic high stress, like years of it, and it could be physicians, it could be CEOs, it could be anyone, any leadership position, right? That constant time pressure, the moral distress, the repeated exposure to the burdens that we carry, the brain really adapts to that. And then that becomes our normal state over a period of time. So we're constantly acting in like a survival mode all the
Mhm.
time. And so if that's how you feel, that could be what's been
Right.
happening.
And so, to your point, it could be the accountant, or it could be the lawyer who survived the
Yeah.
big law case, or multiple.
Yeah.
I also am curious. Could it? You talked about different people processing it differently, but could it also be true that it's processing it at different life stages? So, like
Oh,
earlier versus later.
yeah,
Okay.
absolutely. And I think it also reflects the chapters that we're in, the
Yes.
stages of life that we're in, right? And I can just use me as an example. I, when I categorize my life, it's when I was, medical school, then residency, and then before baby, before
Mm-hmm.
COVID,
Right.
after
Yes.
baby, right? All of
Mm-hmm.
those things, different changes and stages in our lives, we have to adapt to those varying things. And I think our needs and wants evolve too, just as
Yes.
humans,
Yes.
and giving ourselves the grace and okay to also adjust to those needs too.
Right. Because our professions may not have. we may have had to almost be perfectionists, right? In any career, not just medicine, to get to the place we got. And that can at some point sabotage us from a healing perspective, correct?
Absolutely. Perfectionism, I think, is not unique to physicians in
Right.
particular.
Yes.
We've had to have very high standards to get where we are.
Right. Right.
And so to humanize that, whether it's our identity as a career, right?
Yes.
What we call, especially in the US, I think we
Mm-hmm.
use that as a huge form of our identity is what we do.
Right.
Um, I think that is very, very closely linked together.
Absolutely. So I'm glad you said that. And I wanted to clarify that, I'm internal medicine trained in my background. What I work with primarily are women, let's say 30 to 55-ish. And a lot of our work is around transitions. So the transition of, I don't have children to I wanted to have a
Mm,
child, but now I'm infertile. And how do I deal with infertility, right? And still balance my job. Or I had several children and now I suddenly find myself expecting what I didn't know I was going to be taken care of, which is my story. And then there's the transition of going into perimenopause, right? Or I want children deeply. I had infertility. I lost the pregnancies, right? Like
mm.
all of the stories around that are who we serve, the perimenopause. And you're going to see that show up today because my brain is totally perimenopause affected. And I cannot for the life of me like think straight today. So please give me a little grace. I'm trying to give myself grace because it's
That's
embarrassing when it happens,
okay.
right? Like, what was that word? I just had it. Thank you, perimenopause brain. And really creating the story for ourselves and giving ourselves permission to not have the stories our moms and grandmothers may have had to live with, right? Because we're not living their story. So that's who a lot of who we serve. And I hear those. And that's why I wanted you to clarify that that was what you meant. And so we're going to pause just briefly on all the official stuff because now I do want to ask one fun question. And I love that you brought up identity. Absolutely. If someone asks, what do you do? The first thing is, I'm a doctor, right? Like I'm a physician, whatever. But I want to know who you are without the credentials.
Oh man. I it's something I've spent so much time on. Um, because credentials are a huge part of my identity, but also my
Mm-hmm.
other identities, like I see them as credentials. I think
Mm-hmm.
one of the most important ones is me being a mom.
Yes.
I have a 2.5-year-old. And it's really interesting you mentioned transitions because there's so much emotion involved. Like particularly in my opinion, grief
Mm.
and guilt involved
Yes.
around transitions. And so
Yes.
that's certainly like pregnancy, birth, the whole postpartum time. Like I
Right.
had a lot of postpartum anxiety too. There was a lot of guilt and grief involved in the
Right.
transitions before, during, after birth. And then again, transitioning before, during, and after my full time. I used to be in full time academics.
Yes.
And letting go of what perfectionism or our expectations of what I thought that title looked like when I
Yes.
was in full time academics, hospital executive leadership, all of
Mm-hmm.
that. Um, yeah, it's interesting. You bring that up, and I don't think that that is unique to me. I think it is
Yeah.
something that is very much shared with all women, high achieving
Yes,
professionals.
yes. Even if you're the CEO of your home, right? Like
Yeah,
you have a certain standard and expectation, and you're really acting from some type of thought, which is often this is what it looks like to be a good mom or a good doctor or whatever the thing is.
yeah.
And I love you brought up academics. There's probably others I'm blanking on right now, but I think physicians particularly have this sense that we need to stay in academia and we have to teach and we have to give back and all the things. And the only way we do that correctly, quote unquote, is through academics. And when
Mm,
I left academics, that was a big part of, I had to let go of that part of my identity to say that I need to redefine what does it mean to be a good doctor? A good
yeah,
doctor does not mean I'm a professor necessarily. It might have meant
yeah.
that for that time in my life. And I hear that from other physicians. Interestingly, I don't hear that story as much from my attorneys or accountants and engineers. There's
Mm,
probably a similar parallel that they could teach me about, I would imagine anyway. But it's just
Yeah.
interesting that medicine tends to focus so hard. I mean, do you remember in residency when you're reading the note of the patient that got transferred in from the other hospital and it was the outside hospital, the outside doctor, as if they weren't a good doctor, right? And it's just these kind of biases that we don't realize there's a difference in that we tell stories from. And that's true whether we're a mom or not, whether,
Yeah.
whatever level on the executive leadership train we're on or not. And I love that you've pivoted in your career and that you felt able to give back in this unique way. Because I heard you say you wear 3 different physician hats, but you also have the mom hat, right? And the friend hat, and perhaps, I don't know, I'm making this up, daughter. You tell us. There's other
Yeah.
hats that we wear as women. We get paid for one of them, or 3 of them in your case. And then we go home and do our full time job that we're not paid for.
Yeah.
That's
It's
hard.
so interesting. Like so much of what you said is interesting, and I think there's like a level of truthfulness that we all share. For me, I think I realized the most important job I wanted to have was me being a mom.
Bravo.
And looking at, and this is not to say like, I think this is just going to be different for every single person,
Yes.
depending on the stage
Yes.
in your life. It's just right now, during this stage in my life in the last couple of years, that's what I really wanted to concentrate on. And so
Yeah.
it took a lot of work of me stepping back and really looking at, okay, these are my goals. This is what I wanted to do. This is how I wanted to show up. And this is how I want to feel on a daily.
Mm-hmm.
So how can I reconstruct my life
Yes.
so it
Yes.
supports that goal at the end
Right.
versus, the other way around of what a previous, and like so much of our medical education is based on this hierarchical of like external validation. We want to
Right.
please the person, our boss, whoever it is,
Yes.
right?
Yes.
Above us. And what really make me happy?
Mm-hmm.
And in my previous life, the answer was yes, but I think it
Right.
was yes for all the wrong reasons.
Yeah.
Um,
Yeah.
and so again, it took a lot of, for me, like internal work coaching to kind of dig through all the noise. I call it noise, right? The
Yes.
noise, the
Yes.
expectations, to realize what it is that actually makes me happy and
Yes.
um, recalibrate
Mm-hmm.
everything to
Yes.
to
Yes.
fit the pieces back in my life.
To have alignment. Absolutely. One of the stories I share frequently is that I had to have it was really a catastrophic emotional event for myself to realize I could do that, to give myself permission to create the life I wanted and to
Wow.
reject the parts I didn't. And I have always wanted to be a mom. I have 5 kids, and the only thing competing with that became very clear in my late 20s and 30s, which was my job. Right. And I still work full time, but it took me 8 years from the time I finished residency to where I was brave enough to finally open up my own shingle, if you will, and best decision I ever made. But the price I paid for that was that my daughter, my oldest at 7, asked me, "Why do you love your job more than me?"
Mm.
And when a child feels that disconnect, they're not making that up. A 7-year-old's not
Yeah.
manipulating you, right? Like that's
Yeah.
the truth as they saw it. And it's taken years, right, to recreate the narrative for that. And so for our listeners, if you're in a situation where you feel like you don't have answers, you can reject that thought. You don't have to
Yeah.
keep it. And it might have been serving you at one point and not serving you now. Or maybe it's true. I'm not going to judge it for you, but give yourself the permission to ask the questions.
Yeah.
Because when you ask the questions, you can start looking differently. And as your work as a coach, I want to just highlight that for a second. And I'll tell you a somewhat, I think, humorous story. I'd never heard about coaching ever until this little old lady in my previous practice had like 3,000 patients. She saw me once a year. She brings in this letter from her insurance company. It says that she can get a health coach. And I had never in my life heard about health coaching up until that point. They didn't talk about it in medical school. And I'm like, oh my gosh, they've got her. A scammer found her. They've got her, right? And so, like, my social justice warrior hat goes on. I'm like, this is not true. Let me find out for you. Like, I'm going to protect this frail little woman, right, from being abused. I feel like I'm superhero here. So I'm researching it, and I call, and they're like, oh, no, it's a health coach. I was like, what the hell's a health coach, right? And so then I'm looking, and I learn, and then I find there's life coaching, and there's executive coaching, and there's all this different. best thing I've ever invested in my life was coaching by far, of all different types. And so I love that you're a coach, but can you just briefly tell our listeners, I know you work with physicians, but there's coaches for everyone. So what is coaching? Why is it of value for ambitious women who are trying to figure out and redefine and all the things while simultaneously be true to, I don't know, their faith, their health, all the things they also want to do that they feel called to? And how's it different from therapy?
Yeah, that was going to be my first statement.
Yes.
Therapy. There is a lot of diagnosing involved with therapy and processing of past events. Versus, I am not a therapist at all. I'm a certified coach. Coaching, we really look at your current situation and clarify what it is you actually want, and it's very much moving you forward. Like, what are your future goals, and how can we get you there? Um, it is in the so I'm a career and life coach. So in the context of, let's just say, life, right? It is, maybe it's looking like I do a lot of work-life harmony. And so what does it look like for a high achieving woman to be ambitious and want to, let's say, get promoted and have a career, and also juggling, life at home as a mom, as a wife, as a daughter, and all the other identities you might have, right? So what does that look like to you from a harmony perspective? Maybe it's not balanced, maybe it's not the same, maybe that changes based on the seasons of life that you're in. But really getting clarity on that and what the end goal is. And then we kind of work together on how we can get you there. A lot of it requires breaking down a lot of these limiting self thoughts and beliefs, expectations. So, like, for example, my postpartum anxiety was around breastfeeding. My baby was born in the 3rd percentile. In my brain, I don't know why, I had this idea that I had to exclusively breastfeed, or else I was, I don't know, a failed mother, a failed person.
Yes.
Right. And I did everything at a huge cost to my mental health. I don't know that I would ever do that again. Right. So, like, I wish at that time I got a coach very shortly after that period of life, because I felt like I needed help. But I always wish now that I had gone back and had I talked with a coach, I think it would have made a really huge difference on how I might have done things differently based on those limiting beliefs, because it's obviously not true.
Correct.
But I just could not get that thought stuck out of my brain.
It's hard to recognize your limiting beliefs for yourself too. That's what I've learned in almost 10 years of being a coach and being coached, right? Is that person who's trained as a coach can reflect and mirror back to you things you might not see. They might ask you, you might say something and totally believe it, not realizing you believe it, that it's a thought, and they can say, wait a second, is that true? What do you mean, is it true? Of course it's true. Well, wait a minute, maybe it's not true, right? And start that processing. I have found, and I say this with love in my heart, because I think ambitious, successful women, we have clawed our ways to where we are, right? Come hell or high water, we've gotten here. And we've paid a big price for it in all the professions. It doesn't matter. It's not just physicians. We've paid a price to be where we're at. And we did that because those thoughts got us there because they added a value at the time. But that doesn't mean they're still serving us and becoming the next version of who we need to be to do the things we want to do.
Right.
Takes moments of work. And I don't find that even if I try to set aside time on my calendar for myself to coach myself, it works very well all the time.
Yeah.
When you figure that out, you need to teach me, but I have not made it there yet, right? And so investing in a coach who can reflect back to you, even if they're just like, this is what you said, is that what you meant? And last week you said you were going to work on this. How did it go? That accountability. And where do you want to go next week? Take some action, have a strategy, right? Like, those are the things that I feel most blessed by in the coaches I've worked with. So I just want our listeners to hear it from you, kind of what you do. And if you're a physician listening and you're looking for a coach, check out Dr. Cynthia. We'll get all her details in the show notes. But, for the other professions, where would you send them if they're looking for, let's say, a life or a career coach? Is there a place to get them started?
Oh, that's a really great question. There's a lot, a lot of amazing coaches out there. I think it really depends on what you're looking for. Because, like you had mentioned, there are a lot of different types of coaches. So is it around career? Is it around life? Asking around, posing, I think, information to Facebook, doing your research. I have had so many different coaches. I think part of it is also talking with a lot of different ones and seeing what it is you like, what you don't
Mm-hmm.
like, and see who's
Personality
the best,
fit.
yeah, like a
Yeah.
best fit for you.
Mm-hmm.
It's the spiel I give to a lot of my patients when, we talk about mental health and therapy. I think the same goes for
Right.
coaches. Talk with a bunch and see what feels good, what feels
Right.
aligned with what it is
Right.
you're looking for.
And more, I'm seeing companies offer this as a benefit through HR. And so if you're
Mhm.
totally stuck on where to start, you might even start there. If you're just like, I need, it's more along my career, I want some coaching on. It's not like they're not going to talk about your family if you bring it up during coaching or your health or
Yeah.
anything else. Like they can help you. And if they can't, they can point you in the next direction. But I'm finding a lot of those companies, small or large, do offer that if you ask. About your benefits. So, very cool. Thank you for addressing the coaching part because I wanted to make sure we understood what that was for our listeners. We're going to take coach hat off for a second, switch to your medical doctor hat again. Your residency was in
So it was 2016 to 2019. I graduated and became core faculty and then inpatient director right before
COVID.
COVID.
Congratulations. And what specialty did you do?
I am family medicine.
In family medicine, both
Yeah.
internal medicine and family medicine.
No, just
No,
family
just
medicine.
family. Okay.
And then ended up getting obesity medicine certified. So I'm double board
Got it.
certified in family and obesity.
High five. I am too. It's nice to meet somebody else. When I see you at the conference and I can't remember why I know you, you have to tell me why, okay? Because, like I said, metapraise brain kills me. I will recognize your face and remember the conversation, but not why. So, judge me if you must, audience. Okay. Let's think about. Actually, COVID's a great place to start because I know that's exactly how I feel. COVID changed medicine inside and outside, right? I left my job in 2018 because they wouldn't do telemedicine. And lo and behold, I joined a group, I started telemedicine right away. So by the time COVID hit, my practice was already 50% telemedicine. And it was no big deal for a lot of what I do. Obviously, surgeons had a different story, but it was okay for what I did. I am curious, what are some of the transitions, just from the medical hat side, that you think were great that came out of COVID? And you're grateful that we had to go through that horrible episode because this is better for patients.
Yeah. I mean, you hit the nail on a big one, which is telemedicine. We
Mm-hmm.
are able to do so much through telemedicine that I had never thought we could do. So much
Yes.
chronic disease management, and I think we've gotten creative of utilizing our resources. So, like, for example, working with home health
Mm-hmm.
agencies to provide equipment and do checkups and blood pressure and all those things at home for some patients who cannot actually make it into the
Right.
clinic.
Or it's just a
And so,
burden. It takes an extraordinary
yeah.
amount of work.
So I think that's a huge, huge plus. Increasing access to care for
Mm-hmm.
patients, I think through these telehealth options, I
Mm-hmm.
think just has been hugely beneficial. It's so much easier for someone to ask for a refill just,
Yes.
online,
Yes.
versus having to come in person for that.
Mm-hmm.
I think a lot of safety protocols. So I did a lot of quality improvement safety, like order sets protocols around COVID. And I think that has changed dramatically,
Mm-hmm.
pre and post COVID for the better, in a lot of ways, because then you're able to systemically institutionalize and implement certain safety net measures
Mm-hmm.
that contribute to patient health. So I think that's changed quite a bit. I'm trying to think. For me, I think one of the biggest things I've learned, and as a resident, you kind of think, and maybe this is for any profession, not just medicine. You kind of think, um, wow, these are all the things that I need to learn and I need to grow, and this is just how we do things. Like, this is how you treat, you know, pneumonia. This is how you treat syphilis, etc.
Did you say
nobody,
syphilis? Did I hear you right?
Yeah,
I love it. Pneumonia to syphilis.
Right? But it's like very protocol, right?
Yes,
and then
yes,
you had
yes.
COVID and nobody knew what was happening. And I realized that is what so much of what medicine is. We're all just doing the best that we can with what we have, with the guidance that we have. But I remember waking up in the middle of the night and trying to see like, oh my gosh, did like CDC or did anyone overnight in the last 8 hours come up with anything new that I could use to help my So I think that was one of my biggest takeaways from COVID, is that it is so like, we are all human. We're all doing the best that we can and we're all learning together. So I think just having grace and compassion for each of us, ourselves, and for others and those that we work with, is really important.
100%. One of the things that I strongly saw happen, and again, it was there already. There's this idea of, or rejection of the idea that doctors know everything, which is highly ironic to me, because most of the doctors I know, and I know there's exclusions, but most of the doctors I know, if I said, do you think you know everything, they would fall over laughing, because it was such a funny thing. They would know that they didn't know everything, right? And I know that there's those doctors on TV and in real life that are just like horrible in the way they treat people. So excluding those, I don't think most doctors, or anyone in the healing professions for that matter, wake up and think, ooh, today I'm God and I'm going to make all the right decisions, right? Like, I'm praying every morning, God help me not hurt my patients, right? Like, I think that's a more realistic place for most of us. But COVID amplified the distrust that people were already feeling. And what I think is fascinating about it is it didn't do it in a way that was necessarily obvious. Where I saw it change, I saw all the stuff on Facebook and social media and all the influencers, but I started to see more of Dr. Google and Dr. ChatGPT, especially in the last year of the latter. And I have some patients now, because of the way our local systems release, let's say, an x-ray information, they may see it before I do. One person in particular is great. She throws in the thing into ChatGPT and then she calls me and I'm like, okay, I don't even want to know what it says first on your report, because I know you've already ChatGPT'd this. So what did the good doctor say? And then let me put this in context for you, right? But that is not necessarily what the type of attitude or approach I was taught in medical school. It wasn't what I saw at the university or in corporate medicine. And I suspect that wasn't my isolated experience. I expect you probably saw or even are still seeing some of that. Does that resonate to your experience?
It's changed medical education, and how learners are learning today.
I bet it would have to.
And it is an area where we are still, so I'm involved in a lot of advocacy. We are still trying to figure out how to provide context and protocol for that, like institutionally. So like AAFP has, American Academy of Family Physicians, just created a partnership with Open Evidence, because it is happening.
Yeah, it's going to.
People, and the crazy thing is, you're getting wrong information a lot of the time.
Yes.
Like I tried
something on
I tried, asking a question and I saw the answer spit out and I was like, this is incorrect.
Right. Yes.
So what can we do moving forward to at least provide the proper information to those who are looking it up? So I think this is one way, this partnership with Open Evidence is one way, but also it's trust but verify, right?
Yes.
Like see, okay, I see you're reading this information, but where can I verify this? Okay, go to your doctor and talk with them about what it is you read. And I like the way you say it provided in context, because AI and machine learning can get you so far, but I think the humanism aspect of medicine is always going to be needed it's just so complex. Like when someone comes in with all of their like mental health, socioeconomic, like everything, medical, all of it together, there is just no replacement for that. And so I think it still really is important to verify any information and have that talk and discussion with your doctor, and just make sure we're on the right track there.
Absolutely. Yes. I had somebody else who came in and they said that they had multifocal pneumonia. And I was like, really? Because your imaging doesn't look that bad and you're not on a breathing tube in the ICU. So I think you probably don't. But that disconnect, at least when I use ChatGPT, it's convincing, right? So for my business, I tried to put together like I don't know what the legal word is for it. We'll call it a contract. All the lawyers are probably rolling their eyes at me right now. But my husband's an attorney, and I was like, I'm just going to expedite this, right? I'm going to use ChatGPT. I'm going to tell, this is my position, this is the details, create me a contract, and then I'll send it to him rather than making him do it on his own. And I sent it to him, and he's like, what is this nonsense? I was like, oh, that backfired. So it looked good to me. I thought it read great. He's like, what are you doing? Right. And so hopefully your doctor, if you're listening, hopefully your doctor doesn't take the approach of what are you doing? I just expected it at this point. And I feel badly for patients because they come in and they're like, I know I shouldn't have looked. And I'm like, but you did. So let's go with it. What did you find? Right? Like, what are we dealing with? And let's talk through it. And that's just my style. But I know some physicians who are very frustrated and even, if I can use the word, threatened by it. And yet, to your point, like, this is where the future is. So how we embrace it, I guess, is what we still have to figure out. But that's what I think COVID also gave us that was a blessing, was people started owning their health more and challenging the story and saying, is this right? Is there evidence? Because lack of evidence does not equal proof of harm. And that's a tricky place. Push back if you disagree, though.
No, I was going to say, I actually love that patients look up information. I just want to make sure they're looking it up from verified, trustworthy sources, because I think there's a lot of misinformation out there.
100%.
And medical information that is just not true. So I think knowing the resource, and if you know it's a trustworthy resource, I think that's the important thing. So all for that. And then I tend to want to say, make sure you look it up from like these trusted websites.
Yes, absolutely.
One thing you mentioned, like the distrust, right? I actually think so much of it actually has to do with generational values of physicians either, because what is valued in previous generations is not necessarily what is valued now. The expectations of what previous physicians thought that they should be is not the same as what it is now, right?
Yes.
And
what are some of those for our listeners? What are some of those you see?
Yeah, I mean, the one I just wanted to bring up is what you mentioned, like physicians know everything. I think the best physicians know and understand very readily that they do not know everything, right? But I think this historically maybe came from how physicians were previously looked at and that identity of what maybe that generation of physicians thought that they should embody to be a quote unquote good physician, is that they did feel like they need to know everything and show that they did. Right. I think that has shifted quite a bit. And so I just when you said that, I thought about that, and I thought that was important to bring up is that physicians don't I don't know everything, and also that we are all human too.
Right. And the evidence sometimes changes, right? Things that we think are the right answer is changing, and then we have to go back and say, well, we didn't get that right. And I think the more we can do that with humility individually and collectively, the better it will be for all of us, because we're patients too. I think sometimes that gets forgotten, right? Like, we're patients in the same system that is treating everyone else. So it's to all of our benefit to want it to be better. Okay, keeping your physician hat on for just a second. I want to ask you a couple more questions before I let you escape. I know we're coming up on time. But for our female patients, as you think as a family medicine doctor, you take care of cradle to the grave, right? Male, female. So you know all the different things. If you think about just the females, let's say 25 to 55-ish, right? All those transitions we talked about earlier. And you think about what's important to you as a physician. What are, would you say, areas of let's go just women's health that you refuse to compromise on that's so important to you that women hear, know, understand, receive?
Oh, man.
I know it was big.
Yeah, there's so much around women's health. Obviously, reproductive access is really important to me. I think from a family medicine perspective, preventative care perspective, like all of your screenings, I think are really important. I can't tell you how many times um, from when someone, if you have, let's say, like vaginal bleeding that is not your normal period, or postmenopausal vaginal bleeding, just anything that is not normal, I just so highly, highly, highly encourage you to go talk to your physician, because I think those are things that we're always worried about. And so there's a sense of like, I'm scared to go in because I might get bad news. But the earlier you come in, the earlier things can actually be caught, right? If it's something bad, or maybe it's nothing bad at all. And then we have peace of mind earlier, right?
Absolutely.
I think HRT is really, really important. There's so, like you've seen all the media, there's so much news and information. And when you talk about medicine changing these days, I think this is a huge, it's a huge area, because we are now dispelling what I was taught in medical education to write HRT.
Hormone replacement. It's not the same anymore.
Not at all. And so, I think that idea of like being a lifelong learner, also being open to change. I'm very much, a huge proponent and prescribe HRT now versus in my medical education. And for, a couple of years after, it was the idea of that is not recommended. We should not be prescribing that because of the risks of blood clots, right? And now we're showing that it's actually improved cardiovascular health, improved bone health, like all of these positive benefits that we're seeing. So, I from a family medicine perspective, I'm going to say, like, please go at least for your yearly physical and talk with your doctor, and use this opportunity to talk about any concerns you might have, right? At your mammogram screenings, all of that good stuff. Talk with your doctor. It's just, you are so important as my husband says this, the wife, mom, daughter, right, is like the heart of the family that keeps everything together. And so oftentimes we put everyone else first before ourselves, but your health is the most important thing, because how are you meant to be there for everyone else if you're not there and not able to be there for everyone in your full capacity, right?
It's your biggest asset for business, for sure. And then family, community, all the things.
Yeah.
You bring up HRT or hormone replacement, and I think that's probably the question I'm going to pose back to you, is this idea of what do women in this phase of life, the 20s to 50s, what do they misunderstand about their bodies? And I think I heard you say a couple things that resonate with what I see, which is they'll have a symptom and they'll, what we call, sit on it, not say anything about it, and see if it just goes away. And the truth is, if it's not gone in a couple weeks, it's not going away. Go get seen. I said weeks, not months, not years, right? Because one, you can reassure, or one, you can figure out more together about what's wrong. But the other thing that I wonder from your perspective, and maybe it is hormones, but what do you think women fundamentally misunderstand about their bodies during this season of life?
That's a good question. It feels like I see so many AUB, right? Abnormal uterine bleedings. I have such a low threshold to order all the things, all the screenings and all the imaging. To me, it feels like there is a betrayal of what your body was capable of. And during these transitions, like, there are all of these changes. And so what's going on? Why isn't it working and functioning the way it used to be? And during these transitions, I think I mentioned a sense of like grief and loss and fear even, right? I think it's just really important to lay it all out there and look at these as chapters, right? We talked about seasons. And so, yes, there is a chapter that is ending, but also a new beautiful chapter that is beginning, and what could that look like for you after
Right.
processing it, right? Because I think it could be really beautiful.
That's exactly the word I was thinking. Just listening to you, I'm like, oh, that's so beautiful the way you're saying that. It is. Absolutely. Okay. I might have interrupted that train of thought, so sorry.
Oh,
This
no.
is where the rabbit trails I warned you about might go. Last question, almost last question. So I'm going to invite you to put on your rebellious hat for a second.
Okay.
And is there a place in the advice medicine gives women that is actually harmful to you? And while you're thinking about that, I'll give you an example with mine. I don't think that all women should wait till they're 65 to be screened for bone densities, for osteoporosis. I think there's good evidence to say a lot of women should be screened as soon, like 2 years after they stop having periods, if they're not on hormones, etc. And that is totally against what like insurance companies want me to do, what the United States Preventative Service Task Force recommends, etc. So that's my thing that I own, and I'm like, no, I'm going to be a rebel on this. And I'm just curious, is there any place that comes up for you that you'd like to be a rebel on?
For me, a lot of it is around cervical cancer screening and breast cancer screening.
Ooh, say more about that.
So I had, I can't tell you how many young women I've seen who theoretically don't have any risk factors, but then you see that they do end up, and like I say this because I know one of my colleagues this has happened to, where back then there was very much, okay, very young, no mammogram screening, even difficulty with insurance, so difficulty getting that ultrasound, ended up having like stage 4 breast cancer. And a lot of breast cancers, it's not just like they're so invasive ductal carcinoma. It doesn't always come up as like a huge lump. Like early signs of that can be very subtle. And so that's where I say come in to like get screened, talk to us. If there's something that doesn't look right, feel right, is off, I think it's just really important to bring up, and so we can talk about. And so had that person's concerns been taken seriously earlier, had they had the resources to get an MRI earlier, I think a lot of that could have been diagnosed a lot earlier. So that's why I say I have a very low threshold to get the ultrasounds, get the mammograms, like do all the screenings. Same with cervical cancer and uterine cancer screenings. I've diagnosed uterine cancer in a 27-year-old.
Jeez.
Just so young. And cervical cancer, nobody decided to take a look for this person having vaginal bleeding and all. Cervical cancer is very, 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 very slow growing. So this person must have had this for a very, very long time. So, if somebody comes in and they're concerned at all and asks for it, and there is a shred of truth and a shred of evidence that even suggests it, I just do it because I feel like better to be safe than sorry, these are people's lives.
And we get pushback from our peers that, oh, you're spending all this money. And the truth is we're going to spend a lot more if we miss a cancer, right? Like if it gets to stage 4 cancer. And that's just financial. To your point, this is a person's life. This is someone who's valued and worthy and deserves a different story and outcome. So I love that you do that. I applaud it. So good job. Thank you. Thank you for sharing that. And I know we're kind of taught to conform, so being a rebel feels a little bit uncomfortable to us, but good job. You did it. As we close, if we have physicians who want to check you out for coaching or other people just want to follow you, I know I see you on Facebook. Tell us, we'll put this in the show notes as well, but tell us how people can get in touch with you.
Yeah, my website is www.thrivationcoaching.com, and you can email me at thrivationcoaching@gmail.com. I'm also on Instagram, Facebook, very easily reachable.
Yes, and you do some nice posts. I'm like, oh, that was good when I read them, so thank you.
Well, thank you for reading.
Yes, I do. I do. I think it's helpful. And, it's funny. I don't always find things at the right time. So I might see it a day or two later, but I'm like, like, oh, that was really good. So yes, to our audience, if you haven't checked it out yet because you didn't know about her, now you do. Follow her, learn and grow together. And you're saying Thrivation, like THRIVE, Thrive.
Oh, yeah, let me spell that. So Instagram handle is at Thrivation Coaching, THRIVATIONCOACHING.
Got it. And again, we'll put it in the show notes, but I just want to make sure because some of these words are a little funny when you're hearing them by audio that we have the right thing. So thank you for being here today. Appreciate that you gave generously of your time and wisdom to share with us. Certainly for our listeners, if something in today's conversation resonated, you're not crazy. You're not alone. There's a reason you feel like it resonated. That tension you feel perhaps between ambition and leadership and your health, it's real. It deserves thoughtful consideration, not dismissal. So you'll find the deeper resources, next steps in the show notes. If this episode helped you feel seen, share it with another ambitious woman who's navigating her own journey. We lead better when we lead together. Until next time on The Authentic Physician, we'll see you then.